bunch of brain scans. I tend to group my scans by site or specialty so I can focus on a limited quantity of possible disease presentations. So it's easier to figure out stuff. If you go back and forth between specialties, it makes it tougher to wrap your head around it, at least for me. So I tend to report a bunch of brain scans, then spinal scans, vertebral scans, then I go to knees and shoulders and all that, and then small bones and joints, and then I go back to brains and I hit some specialties on head and neck, so it makes a change and makes reporting less boring, and I go back and forth. We still have 3 brain scans to go. Oh, this is something else. This makes sense. This is a contrast enhanced brain scan. Patient, it's a male patient. He is 57 years of age, and it says here he has headaches and has gone through some sort of trauma to the head in the past. So this So this is FLAIR. This is T1. So FLAIR right there. There is a major surgical site right there. There is bone remodeling. There is a partial craniectomy right there, and a huge area of Malacia and gliosis on the left frontal lobe, and a severe or at least moderate dilatation of the frontal horn of the left lateral ventricle. So this is indeed a chronic lesion. I can see the ependymal surface right there. So there should not be a direct communication between the area of Malacia and the ventricle itself, but it could be. I can't really be sure if I don't have a very thin and volumetric acquisition, which I don't have here. They didn't do anything like that because why help us report this crap if you can make our life just a tad bit harder? So if you can make if the technician can make the radiologist work harder, he will definitely do it just out of laziness. Why do it right if you can be lazy and do it just wrong? That's how life is. I can't see much more than that on these particular sequences. We should have hypointensity areas around the site of Malacia, because this once was at least partially flooded with blood. So there should be blood deposits around the site of, just like that, of Malacia and gliosis. Fine. Diffusion-weighted sequence. Is there anything that draws our attention to a possible site of acute disease? No acute disease, just chronic disease. T2 is here. Yes, major area of a brain excavation. A huge site of loss of brain matter, just like that, and a moderate dilatation of the anterior horn of the left lateral ventricle. Let's see how that looks. See? That's how it looks on the sagittal view. And of course, it's dark in T1 and bright in T2 weighted sequence because it's pathological. Yep. The pituitary gland is fine, all the cisterns is fine, and besides that particular site of disease, the rest of the brain and associated anatomy seems quite fine. The orbits are okie dokie. Some sinusitis, but there is always sinusitis. There is really no need to describe that. Oh, we have a contrast enhanced sequence right there. So beware of possible thrombosis. I had a case yesterday of headaches, and they thought it could be an aneurysm, so they ordered a arterial intracranial angiogram and also a neck arterial angiogram, and I could see that the patient had an acute thrombosis of the superior sagittal sinus, so a very dangerous thrombosis. There is no detectable enhancement on the margins of the site of loss brain matter, which means this is a very, very old site of disease, not a nearly established one, because that could be a slight enhancement on the margins of the Malacia and gliosis region. So this is old news. Let me just check for anything on the FLAIR sequence once again, so we can move on with our lives. So some tiny bright spots. I'm just not going to report that because this is a trauma patient in that area of Malacia and gliosis, and blood product deposits is just freaking huge. So let's report it. This is a very common lesion. Trauma to the head in this kind of lesion is quite common, so nothing major here. It is just a major area of Malacia, gliosis, and blood product deposit, which is, I suppose, in English called Hemosiderin, because in Portuguese it's Hemosiderin.